Okay, so this is the second part of my presentation. We'll start back up at case number 5 here. And I know it's on the next page, but it looks like it's a SOAP note. Let's see. Yes, it's a SOAP note. So, subjective, the patient's having pain in the right hip area, has a new complaint of pain and pressure in the right orbital area. So there's some vital signs, pain and tenderness. And the assessment is pointing out the orbital pain and the right hip pain. And we have a rule out here, but we're not going to code that because for outpatient we don't code the rule outs. We code the signs and symptoms, and the sign or symptom would be the right hip pain here. So we're going to go to our diagnosis, and first we're going to look at the pain in the orbital region, and it is the right, I believe. Let's see. Yes, the right orbital region. So ocular pain, right eye, H5711. It's our first code. And then we'll have the pain joint. Due to other hip, and that's the right hip. Do not wish to code more. Do not wish to code. So we're just going to code the pain in the right hip, M25-551. So that's our only two codes for this right here. It looks like the plan is to send the patient for x-rays, but those did not occur, and we're not coding the procedures or the services right now. Okay, so we'll go to case number 6. So we have the HPI, physical exam, assessment in the plan. So for this one, we can really look at the assessment. So we have the mononucleosis, pharyngitis, bilateral otitis media, and probable sinusitis. So probable sinusitis is going to be like the rule outs. Down here it says sinus x-ray to rule out sinusitis. So we don't know that that's a thing yet. So here's kind of what the patient's been saying. Here's an important part. She was referred to me by her primary care provider for further evaluation and medical treatment. So this is like a consult appointment, and I think on this one we are coding the procedures or services. So that's important to know. Here's her physical exam. We're really going to look back at this. So let's start with our diagnosis of mononucleosis. Looks like she had a positive mono test here. Unspecified. B2790 from the mononucleosis. Then we'll code the pharyngitis. Pharyngitis. And we'll do unspecified. Do not wish to code. Do not. So this is going to be an acute pharyngitis, J029. J029. And then the otitis media. Other, and it was bilateral. Yes, bilateral. Okay, so H6693 for the otitis media. And that's all of our diagnosis codes. And like I said, do not code for the probable condition, code only for signs and symptoms. Procedures. So we're going to code the evaluation and management consult. Let's go to procedures. It's going to be CPT. This is outpatient. So EM. Actually, let's go back. Let's do consultation services, EM codes. Other, office outpatient, medical decision making because no time was put on there. This is what I struggle with actually is deciding what the medical decision making was based off the documentation. I think I got this wrong. It says that it is straightforward. No pelvic exam. Do not wish to code. So this gives us our E&M code 99242. Okay, and then it looks like we are going to code this CBC with differential and the sinus x-ray here. So add procedure, CBC with automated differential, white blood cell, no, unspecified. That's going to give us the 85025. And then we're going to code the x-ray of the sinuses. Spell site, sinus, paranasal. Without contrast. One or two views. No more sites. So 70210 is going to be our code for the sinus x-ray to rule out sinusitis, and it looks like they did rule it out. So okay, and then for case number 7, we're having a procedure done, the cystoscopy operative procedure. We've got our preoperative diagnosis, benign prostatic hypertrophy, there's a rule out stricture of the urethra, rule out bladder lesions, and then it looks like after the operative procedure, the diagnoses are benign prostatic hypertrophy and then cystitis. So they didn't find any strictures on the urethra or any lesions on the bladder. So this is our details on the procedure. Cystoscopy. The urethra was grossly normal. The prostate gland was moderately enlarged, so there's our diagnosis for that. There was mild inflammation of the bladder mucosa, so that's our cystitis there. But there were no gross tumors or calculi seen in the bladder at this time, so no lesions. Cystoscope was removed and patient tolerated the procedure well. Okay, so we're gonna definitely code our BPH here. Benign. Oops. Excuse me. Let's see. We're gonna do hypertrophy. Oh, I'm still under procedures. So make sure to switch it back over to diagnosis. Do hypertrophy. I think I missed a letter. Oops. There we go. Okay, so prostate benign. And no procedure. Benign neoplasm of the prostate. Ooh, that's not the right code. So let's go back. Oh, there it is right there. With lower urinary tract symptoms. No, I don't think there was any mention of that. No, there was no mention of that on this report. So without, I'll say other, no, and no procedures. There's our code, N40. Then we're going to add our cystitis. Wonder if you can do bladder. Not sure how I found acute. Do not wish to code. Okay, so this is how the program found. This is the correction that was offered. The acute cystitis without hematuria. So in third, oh wait, no, that's not right either. Let's go back. So cystitis. Maybe it's unspecified. Other unspecified. Oh, that's it. Okay. So in 3090, it's unspecified because all it is cystitis. It doesn't say anything about the bladder because cyst is that's a prefix that points us to the bladder, and itis is inflammation. Okay, so our procedure is going to be cystoscopy, and it says through the urethra, so transurethral, diagnostic only, other unspecified, and then that gives us our code, the 52000. And like I said, do not code for the ruled out conditions. There was no evidence found during the cystoscopy. Okay, so I guess we can start with the next one. I'm about out of time on this video. Looks like another SOAP note. Chronic fatigue, no acute complaints. Established patient purchased the, looks like a glucose monitor. She did not bring copies of her sugar. Oh yeah, there's a lot in this one. History of non-compliance. The patient was seen. More non-compliance. She refuses to attempt to quit smoking. So we've got nicotine dependence, neurogenic bladder, and up here there's a lot to do with some kind of lump in the breast. And here it says she's obese, lump found in the breast self-exam on the right. Let's see, diabetes, which we saw up there, on oral therapy, poorly controlled, probably due to the non-compliance. And then she's got chronic small airway disease. There's the nicotine dependence, obesity, menopause, and rule out breast disease is here. Hemoglobin test today, fasting lipid profile today. Okay, so I'll continue on with the next video.